Okay. It's our Dear Darby Live with April,
Alina,
and we are talking today about symphysis pubis dysfunction, which also known as SPD.
Yes.
It might be something that you've heard of. It might be something that you haven't heard of, but it affects a lot of women in pregnancy.
A lot. We want to know if you've been affected. First of all, let's kind of describe what it is.
Yes. Okay. So what it is, so in the name as symphysis pubis dysfunction, it is actually your pubic, we call it the pubic bone, but that bone right in the center where your doctor or care provider is looking to be able to do the fundal measurement, right? Like right
that
there.
Hard bone right there.
But it's not even a bone.
No.
It's actually cartilage,
Mm-hmm.
which is kind of fun. Which is great. And the design of that is fantastic because you have a 6 to 9 to 10 pound baby that needs to move through a bone, a circle bone, but it's not really a circle, it's two halves, to get out of your body. And so that piece right there is cartilage, so it actually is able to move and flex and shift and change.
Like open.
But the problem with it is that it can move and flex and shift and change as you are getting more and more pregnant. No, once you're pregnant, you're pregnant. As your baby's getting bigger and bigger, there's a lot of pressure that is put on your pelvis, but then also that the two halves of your pelvis shift and move and change and slide forward or backward or side to side, or sometimes even twist. That cartilage can twist, which any of that misalignment can create a ton of pain.
So much pain.
So the SPD is they consider is probably one of the most underdiagnosed dysfunctions in pregnancy. Yeah. They say it's on average 1 in 300 women, but they think it's actually more like 1 in 50.
Yeah. Well, because there is levels of pain, right? There are levels of discomfort for people. And so one woman might just be able to be like, walk it off, or, if you just sit a certain way, and others, it's literally can't function because of that extreme pain down in the pelvis.
So the question is, what can you do, right? Because
yes.
We've heard from some women that it was so bad that pain was so bad that they didn't want to have another baby.
Yeah.
We've heard from others that it lasted their whole pregnancy, but then also into their postpartum. We've heard others that,
which is not typical.
No, that's not a typical.
Typically, once the baby comes, the pelvis kind of gets back to itself and can realign and not be an issue again.
But sometimes it happens.
Yeah.
So what we want to offer you is that if you are experiencing any sort of pain, especially in the pubic region, or as you walk, like think about shifting your weight, right? As you walk and as you take those steps, your pelvis is shifting. And if that is so painful for you, then you probably are experiencing SPD.
Yes.
So something that you can do with that is getting number one, get regular pelvic adjustments.
And that is regular is the key phrase, really, because as that baby grows, right, you're shifting all the time. One alignment isn't going to
change or isn't going to
fix it forever.
Yeah.
Because
everything.
like April says, it's cartilage. It's going to keep moving. And so, but as you keep your body aligned, that pelvis aligned, it releases that pain and that pressure, and then you have more mobility. And so just remember, it's a regular thing. One time isn't going to be like, oh, and I'm done.
So and here's the other like subcategory of this is that you want to go to a chiropractor who specifically specializes in prenatal chiropractic care.
Yes.
Because I can't tell you how many throughout my 5 pregnancies, how many chiropractors I went to that I'd be like, my hips, I'm like, my pelvis hurts so bad. And they like crack my back and be like, there you go. And I'm like, no, my hips, my hips. So, which is great. We love chiropractors.
Yes.
We love chiropractors, but there is a specific, like, make sure that you are going to someone who specializes in prenatal care, because they will be able to focus specifically on your pelvis. In fact, there's one of the best, crazily enough, one of the best adjustments that they do is have you lay on your back. I had SPD, so I know this. That you lay on your back and then bring your knees up, like put your your feet flat on the table or bed or whatever, and then they put their forearm in between your knees, and then you have to pull your legs together, like against the pressure of their arm, which will actually, crazily enough, either shift everything back into place or twist that cartilage, so that it like pops right back.
So cool.
Which is awesome.
Yes. And if chiropractic is not your thing, or maybe it's not helping to the degree you need it, a physical therapist is a really good option, because they do very similar things. And the thing that's nice about a physical therapist, and I'm sure chiropractors will do this too, but there are exercises you can do to help strengthen all the muscles that hold things together, very specifically, and that you can be doing those exercises on your own.
Yeah. Yes. To in the interim of getting your like either your adjustments or whatever, that you can actually keep your pubic joint, I guess is technically what it's called.
Yeah, that's true.
You can keep that aligned as much as possible. And we recommend that if you know that you've dealt with it in past pregnancies, that if you become pregnant again, get on it as soon as possible. Again, don't wait for it to get bad. You will have a much better pregnancy experience if you are able to kind of nip that one in the bud.
Yeah. So get to your chiropractor, your physical therapist. Get some of those exercises to really strengthen and align your pelvis. And
the last thing,
the
last thing is one of our favorite things.
Yes. And all of these can be done together, by the way.
Oh yeah, absolutely. Especially because you know the pain that you're in. If you're dealing with this, you know how like it can inhibit your day-to-day life, especially if you have other children that you're needing to take care of.
Yes.
Or
a job that you're trying to, you're active in, and that can be really tough.
Yeah. So our last suggestion for dealing with SPD is getting a belly band. So we're talking like a pelvic girdle kind of thing that goes down around the hips, and it kind of comes up around supports the back, holds the pelvis in place, and even can have straps between the legs to kind of literally hold everything together.
And those straps in between your legs really are interestingly
helpful,
very helpful. But even like just a wrap will be nice, but really those straps, it really just pulls everything up and almost anti-gravity.
It does kind of feel like that. And we love it's belly baby band or baby belly band. Sorry, I always say that wrong. Yeah. But they and if you're not even there's other things that are going on in your pelvis. So we've talked specifically about SPD, but I mean varicose veins or swelling or any
there can be other things going on. That's true.
We just talked about we had a big live in our Unmedicated Birth Academy private Facebook group with our ladies about prolapse, and so and
what to look for and where to go in order to help with that. But all of that
can be helpful too.
Yeah, it just is nice to have those straps. You would think they would be uncomfortable, but they add so
They do
much
help.
benefit that it's nice.
So we actually have a coupon code for you if you would like to get a pelvic girdle, because that can actually even help postpartum as well.
Yeah.
It's in the link in our bio at the very bottom of the page. I think it's like 15% off if you use
10, something like that.
For code Dear Darby.
Yes.
Dear Darby.
For baby belly band, and it's worth it. You'll love it.
And you can get on their website and kind of check out all the things that they can help. So if you are dealing, that is one of my biggest complaints when I'm pregnant is all of the hip and pelvic pain.
Yes.
So it's just
you don't have to just deal with it.
You don't have to. It can be helped.
It can be helped, yes. So and we want you to be as comfortable in pregnancy as possible, because that will help you maintain your energy, maintain your mental fortitude, and for a really beautiful labor and delivery. So we just want to encourage you to not just live with pain or live with typical pregnancy symptoms. Let us know what those are for you, because there's almost always a solution that will at least give some relief.
Yeah. Okay, we hope this helped. If you're dealing with it, hopefully you can get some relief.
Yes.
So we'll talk to you soon.
Okay, bye.
Bye.